Hello, today we're going to talk about adapting your pressure. Well, you do need to adapt your pressure during the treatment, and that is to keep your treatment safe. So, looking at the foot, the ball and the heel of the foot can actually take deeper pressure because we're standing on that. It has our weight on it. So you can go as deep as you like in these areas and you're not going to cause any problems. But the arch of the foot, we don't stand on that. And so that can feel more painful when you're working it. And also, we've got tendons. I like to actually flex the big toe because that's the biggest tendon. If I flex the big toe, then I will see that where the tendon is and identify it so I can make sure I can reduce my pressure on that area. Pressure variation by client factors, well, contraindications and health conditions. So um, sometimes because maybe the client's older, they've got osteoporosis, they've got diabetes, we will need to reduce our pressure slightly. I had one lovely lady in her 90s. She'd actually had reflexology most of her life, and she wanted me to work deeper than I did because that's what she'd had. But she was in her 90s and I was scared of hurting her. So I didn't feel comfortable going as deep as she wanted. So I gave her the the best pressure I could, um, in line with the fact that she was in her 90s. Client preference, some people like a deep treatment, some people like a lighter treatment, and generally it's hard to change their mind. Um, so it is good to be able to give the client what they want. And the attitude to sensation and pain. Now, some pains are like a sweet pain, like the pituitary. It hurts, but it sort of feels like it's doing you good. But that is different to if perhaps you're pressing on a tendon or you've got somewhere really imbalanced and you're working that really deeply. So you need to find out what your client's expectation of his pain for pain. So one of the areas I do like to work deeply in for fertility clients is the ovaries. And that can be quite painful, but I only do that as far as the client is comfortable with it. So keep within what your client wants. Pressure is key to reflexology, but it's really difficult to measure and standardize. So you don't really know what other reflexologists are doing, especially in other locations. And pain is actually subjective, so there's no real measurement of pain. It's a subjective measure, and two people can have exactly the same pressure on exactly the same reflex. One person will feel pain, the other won't. So you've got to be aware of this subjective nature of pain, along with what the client wants. There's been lots of studies where they've tried to measure the pressure, and some have, but there's nothing consistent out there. And so we just don't have any consensus here. And there's also no consensus on whether light pressure or deep pressure are more effective. Evidence suggests both can be beneficial. So the studies showing really light pressure and they've had good results, and the studies showing really deep pressure. One of the studies I was reading, they did adapt the pressure in that if they held the client's foot so that they could pull away if it was too hard. So that tells me that that was quite a deep treatment, or indicates to me that that was a deep treatment. Um, so some therapists believe deep stimulation is more effective. Others prefer gentle pressure to promote relaxation and energy balance. Others believe that what matters most is not how deep the deep the pressure is, but how well it suits the client. And I think I'm sort of in that camp. I don't like causing pain unnecessarily. I think if you're relaxing your client, and relaxing is one way that we are working with reflexology, we are relaxing them, we reducing the output of cortisol, and then you suddenly give them a sharp pain, they're going to jump, and you've got to relax them again before you can carry on. So I try and avoid that. Oh, I do avoid that. I do avoid that. So you've just got to understand your client for this. Client expectation is really important. So the late Professor George Lewis emphasized the importance of client preference when you're looking at complementary therapies. And this is an area where research doesn't really um, work with that. But you can apply his theories to pressure. So if a client wants a deep pressure and they get a deep pressure, they will have better outcomes. If a client expects a deep pressure but receives a light pressure, then they will have a reduced satisfaction with their treatment. Um, and if you're giving your client pressure that they're not happy with, so you always give a really light treatment or you always give a really deep treatment, then the client might just disengage and seek another therapist. So there's no correct pressure, and you just adapt throughout the treatment depending on where you're working and the client. Always keep a good eye on the client. Never apply more pressure than you can comfortably sustain because that's going to hurt your fingers and thumbs. Um, and never exceed what feels appropriate for the client, even if they request deeper pressure. Like my 90-year-old, I gave her as deep as I felt comfortable with. She wanted more, but I wasn't comfortable with that. And she did stay with me because she understood where I was coming from. And I think optimal outcomes occur when the therapy skills aligns with client expectation and comfort. So that's the presentation. Basically, be aware of pressure, adapt it for the client and for the area that you're working. There's no research that will say what is better, but client preference does play a really big part in um, how satisfied the client feels with the treatment.